So my dissertation topic is exploring uh, men- exploring maternal mortality through the lived experiences of African American women with high-risk pregnancies in Georgia. And I'm seeking to answer the question of what are the lived experiences of African American women with high-risk pregnancies in Georgia. And I'm seeking to understand a little bit more about what are the contributors to the reasons that African American women here in Georgia are dying at 3 times the rate of other races from maternal mortality after giving birth or within 42 days after giving birth. And you find that this is true even among various social classes, educational levels, socioeconomic status. You still have the same results that African American women, whether insured or uninsured even, are still dying at 3 times the rate of other races. So my research study will seek to understand what are the lived experiences, what are the possible contributors to this. As a social researcher who wants to make sure that the data discovered will have an impact in implementing social change, I will be looking at things like how the perception of the women in terms of the medical uh, attention that's paid to them when they express concerns, whether they are physical concerns or mental health concerns. This will be done using a grounded theory approach. It is a phenomenological study. I think I said that right. Phenomenon. Wow. We're not going to try to say that 3 times. But it is a study that will look at lived experiences. And also, the theories that I will be looking at is allostatic load, which deals with the stress level, as well as systemic racism theory, and looking at how this may or may not impact the outcomes when it comes to African American women and their pregnancy outcomes. And thus, this hopefully will give us a real clue of what is causing or contributors to maternal mortality. How will this impact social change, you ask? Well, oftentimes we can judge the health of a nation by the health of its mothers and its children. And as we know, our children are our future, and the mother gives birth to the child. And so it's so important that the mother has a healthy birth outcome because that sets the child on, a good pathway, hopefully, to have healthy lives and healthy upbringing. There's a lot of other factors, of course, that I realize will go into what impacts a child in his or her life's experiences. But as a social researcher, what I am aiming to do in the tradition of Walden is to conduct this study so that the data that I collect will be able to be able to inform us about how can we help mothers have a healthy outcome. And it's going to be, at least I hope, very profound in having a significant impact to be used by the medical community, to be used by the healthcare community in general. So this is both physical health as well as mental health. So healthcare providers can be more perhaps in tune into what's needed. I know that just from my literature review that there have been some studies that looked at different things that can help to improve maternal outcomes, implementing some medical standards across the board that are best practices for clinicians to use. However, I would like to think or hope anyway that the data that I gather from this study will help to inform us as practitioners and health providers and people in the field a little bit more about what are other factors besides just implementing best practices as far as medical care, because obviously there's still something that's a disconnect. Because if just implementing best practices alone was solving the problem, then we would not have the high rate of maternal mortality that we are seeing in states like Georgia and Louisiana and other states. Georgia right now is the second highest, has the second highest maternal mortality rate in the United States. Um, Louisiana is the first. And so just really seeking to understand what is happening, what are the contributing factors, and how we use this data to really inform practices. Um, Systemic racism is something I really am going to explore during this study, and also allostatic load. And in the process of exploring those things, the data may very well lead to some other factors that I am surprised to find out. But whatever this study shows, I do believe it will be valuable data that can be shared with providers, not just medical providers, as I said, but mental health providers, with support groups, even, because I believe that there are succinct things that are contributing specifically to African American women having these um, high rates of maternal mortality. And I'm just excited about sharing that. And so I'm being very careful as I talk about this, but because I have not conducted the research yet, but I do expect to find some valuable information because once the study is completed and this information is discovered, then I definitely want to use every opportunity to spread the word. I love speaking and sharing information and helping to increase access to health care and most importantly, access to quality health care. And so definitely I would love to present this data at numerous conferences, be able to attend meetings, and any opportunity possible to really share the findings of the study so that it really can change the conversation and really start to understand when there is an African American woman sitting in your office experiencing a pregnancy, that there may be factors that um, one may be unaware of that need to be explored. And through these questions, interview questions and survey questions, I hope to gather data that helps me understand, what the experience of the African American woman is. I certainly am a mother myself. My children are grown, but I have experienced, of course, pregnancy, and I would say um, one high risk pregnancy. And of course, it was several years ago. But again, just understanding a little bit more about factors that contribute to healthy birth outcomes. And the thing about this, how this can really implement social change, first of all, it's going to help, I pray it does, help change the statistics, change the story. And not only will it impact African American women and other women of color, but there may be some things that are learned that can impact women across the board. And so I really see the potential for profound impact of my study. And I'm just super excited about doing it. I really want to make a difference in this world, and I really want to help people have the best possible start in life. And that begins with a healthy pregnancy outcome so that that baby can have a healthy start. And so, as a researcher, I do believe that this study will directly um, connect and contribute and falls in line directly with or aligns with Walden's mission of social change.